Okay, let's talk about our patient today. Our patient today is a dentist. Young lady, a preeminent lecturer, a dental hygienist from Bulgaria, Buffalo, New York, Atlanta, Oklahoma, Vancouver, Canada, Boston, Kansas City, San Francisco, Montreal, Munich, Germany, London, and Santa Maria, California. And we're going to place 14 Lumineers, 8 Lumineers, 10 Lumineers, 6 Lumineers, 10, 2, 8, 8, 10, 10, 8, 10, 8 Lumineers today on our patient.
And now we're not treating teeth anymore. We're treating smiles.
Isn't that beautiful? So let's look at the transformation from where we started and where we are. Our patient today is an example of that. Good afternoon, London. I'd like to welcome you all to a live placement of correcting a patient's cosmetic appearance with the placement of Lumineers. Now, before we started working on this patient, he thought his teeth looked terrible. He thought he had terrible teeth. The reality is he has great teeth. They just look terrible. So once we got him to sit in the chair, because he's petrified of dentists. Is that a fair statement?
Yes.
Not of dentists personally, but of traditional dental treatment. This is what he looked like before I did cosmetic contouring or tooth modification. I never do preparations. The most I do is tooth modification. And if I start getting into sensitive tooth structure, I stop. And then we say, what can we do to give the patient a perfect smile? And this is what we did on his preparation appointment, if we want to call that his impression appointment. And right off the bat, he looks significantly better. Now, what you have to think about is those two centrals. What are you going to do with those? And what we're going to do with those is make them very thick on the incisal. So this is a very good case to show you what you can do. And it's all been done for me. All I did is modify the teeth, take an impression, and then these pieces of porcelain known as Lumineers were prepared for me, and I'm going to bond them to his teeth. So let's have give everybody a big smile. Yeah, put your head back just a bit. That's good. So this is what we're starting with, and we'll flick back to it as we move along. What you can do with Lumineers is you can practice conservative dentistry. By conservative dentistry, that means that you don't have to do traditional destruction of tooth structure to get a cavity preparation, to get a line of shed, to get all of that. I've been doing these, for the past 20, 25 years, almost, and I've never given the patient a shot. Everything is prepared ahead of time, and you have to have a knowledgeable assistant. My assistant today is Lisa. She's been with me for 20, 30 some odd years. Are we at 30 odd
We're
years
over
yet?
30 now.
30 years?
Yeah.
She came to work for me when she was 6. At any rate, we have a knowledgeable assistant here, and to get your staff knowledgeable, we have these DVDs, and you and your staff should review them 2 or 3 times before you do your first case, because this is all about surface preparation. This is about having everything at the right place at the right time, and when everything is there, everything goes smooth. People say, man, that guy makes it look easy, and the answer is, it is easy if you're prepared. So we're going to have a convenient tray set up. And if we take a look here behind us, here we have the pieces of porcelain. Did you hear what I call them? Pieces of porcelain. You don't want to think of them as being crowns or restorations, because a restoration is going to be what we put between the crown and the tooth, between the luminaire and the tooth. But to sum it up for you, there's 5 surfaces, there's 5 steps. That's why we call it 55. And if you're bonding to enamel, dentin, porcelain, metal, or old composite or acrylic, you'll do exactly the same procedure I'm doing now. What will change is the way you prepare the surface. But I work with 4-power magnification. This is so important. If you're working with less than 4 power, regardless of your age, no matter how young you are, you can't see as well as you can with 4 power. 4 power enables me to get next to the tooth and see when I'm close to sensitive tooth texture as opposed to feeling. The other thing I use that's going to make this go along really well is the Sapphire Light. You'll see me modify these or place these or bond these in about 1.5 minutes for, I don't know how many do we have there, about 8 or 10 teeth?
10.
So we're going to do 10 today. And we'll have those all bonded in less than 2 minutes once I place them. The other thing that's very critical is getting a good impression. So when you send your case in, we always recommend that you pour at least your first model and examine the model yourself to be sure you're satisfied with it. So the bottom line is the impression material, the pack light, the Sapphire Light. You can also do whitening with it. There's a paper being presented at the International Association for Dental Research that shows no matter what your chairside whitening agent is, that the Sapphire Light will increase the whitening, and you don't have to worry about getting the patient exposed to ultraviolet rays and things like that. So our patient today chose Lumineers because?
For the way that my teeth were, and because I don't want any painful work done by a dentist.
So what you want to do is you want to have a more attractive smile, and you don't want to endure any pain getting it.
Correct. I'm a coward.
Okay. Well, I guess that takes care of the preamble. If anybody has any questions during this process, you can ask them. Lisa's going to put the cheek retractor in. And before we went live, Lisa has polished all of his teeth to get rid of the plaque with the porcelain polishing paste. Now, the reason we use porcelain polishing paste is because it removes the plaque. If you use pumice, all you do is push the plaque around. So it's a non-aqueous, fine particle, pleasant tasting paste for polishing these. It's the same one we use for polishing afterwards. Lisa has already treated the porcelain with porcelain conditioner. That's a citric acid. It hydrolyzes the cerenate prime. Cerenate prime is a silane. Why do we do that? Because you want your silane most active when it gets activated, when it gets hydrolyzed. And remember that it's going to create a high-strength chemical bond between the porcelain and the composite that is not going to microleak. That's a very important part. Microleak is the enemy of adhesion. That's why we recommend Ultrabond and Cerenate Porcelain and Tenure AB. They're matched, and they've been clinically proven to last over 20 years. So I guess right now we'll start the process of transforming this person's appearance. One of the things that is going to simplify it for me, I'm going to fill the posterior side, the lingual side, with Paint-On Dental Dam. And I'm putting the Paint-On Dental Dam in the lingual interproximal embrasures. You'll get a chance to look at this here in just a minute. And where you have this tapering tooth structure, or bulbous tooth structure, you want to cover that, but be careful you don't have it go too far to the labial, or it'll prevent seeding of the luminaire. Okay. Now we're going to take the Sapphire Light, hold it approximately 1 inch from the surface, and give it a 3-second blast. Close your eyes. The best way to protect your eyes, and it's very important to protect your eyes, is to close them. So I place it, and then I close my eyes and push the button. I don't want the Paint-On Dental Dam to get completely polymerized. I want it to be in a semi-rigid state. Close your eyes. What I'm testing right now is to make sure that the Paint-On Dental Dam is in a semi-rigid state so it won't run all over. I want to look on the labial and make sure that none of it is running out. So you can see that blocked out in here just a little bit. It's a little difficult to tell, but I can. And this gives you a very good picture of what we're going to be encountering. And of course, when you look at that labial surface, the patient's going to have some degree of awareness that those teeth are thicker. And our next step now is to begin surface preparation. So I'm going to use a material called Etch and Seal. It's medium viscosity, contains aluminum oxalate, And I like to use that so when I put it on dentin, it can seal the tubules with the oxalate. Whereas if you use phosphoric acid without the oxalate, so we call it etch and seal. And now, you see it's not running all over, so I take my brush and I push it around to precisely cover the areas that I want to etch. And I like this, instead of having a low viscosity etchant that runs all over, I have control of the surfaces. Now we have the teeth etched, and our next step is to place tenure AB on there. And the reason I use tenure AB is it does not need a light to cure it. It's independent. It gives the strongest bonds you can possibly get, either on dentin or on enamel. Not in the laboratory, but clinically speaking. So by putting this on, we keep increasing compensation for the margin of error. And that's what this system is all about, compensating for clinical errors that we can make at the chair. For example, Ultrabond is light cured, but it has a kicker in there for autopolymerization if we don't get enough light to it. So now comes the next step. We're going to test it for shade. What I'd like to do is show you what, and it's a little difficult on this one because these are a little thicker.
It's a left central.
Left central. Lisa always calls out the name of the tooth, not the number for me. Okay. And when I try these on, they don't fit very well. And you say, what are you going to do about those margins? And I say, I'm going to have a perfectly sealed margin. And it's going to be sealed with Ultrabond. And that's what we have on the right central because we have the Ultrabond tri-end paste on there. And on this side, we don't. So this side, we're getting a reflection back from the lingual surface or the backside of the etched surface of the porcelain. And the light stops being transmitted. Whereas here, the transmission goes all the way back to the enamel, and then it transmits back through that medium. I'll let our patient take a look at the shade, and he gets to participate in which color do you like. Which one are we going to put on this one?
B1.
B1? What's on the right? B0?
A1.
A1. There's not enough on that one to fill the gap. There we go. Doesn't quite fill it. Okay. So when we place these, I'm going to have them loaded a little extra. Okay. And now we have two shades. So we're going to let you pick a shade. Do you like the shade on the left better or the shade on the right better? Or do you care? Pretty close. You like the one on the left? Or do you like the one on the right?
I got her.
This one right here on the right? That's the one I like. Okay. All right. So we've agreed on the shade, and I'll take these two off. Remember, we've treated the surface with tenure AB, and we're going to have pretty full loads in those too. Okay. Then we're going to remove the excess from the tooth. You don't have to wash it off. It's not water soluble. So I remove that. And then I start putting tenure S on. Now what Lisa's going to do is take tenure S, and she's going to be cleaning the tri-end paste out of the veneer, just as I'm removing it from the surface of the teeth. And I'm doing that with a solution called tenure S. Now what tenure S does is it's a resin. It'll polymerize with the Ultrabond tri-end paste. So if I inadvertently, or she inadvertently, doesn't remove all of the tri-end paste, it will polymerize just like the Ultrabond will Now Lisa's taking, and even though it's in a double-barreled syringe, we always like to put it out and manually mix it as well. You'll get about 10 to 20% more bond strength and completion of the polymerization when you do it this way. Okay. Tooth,
It's a left central.
left central. Okay. And then the right central. What I want to do, Lisa, is get the left lateral. Okay. Right central.
Right central.
Okay.
It's left lateral.
Left lateral.
Mhm.
Okay.
Left cuspid next.
Nope. I want the
right
right
lateral.
lateral. And then we'll do the right cuspid.
Right cuspid.
Remember, we're filling the space with a restorative material. That's called Ultrabond. And now I need a brush and the 2mm tip for 1 second. And I'm going to take a lot of this out. Now I'm going to place the 2mm tip for 1 second. Close your eyes. Close your eyes. And what I'm doing with this is polymerizing. Close your eyes. Okay. We'll do
Right
the
side.
right cuspid and the right two bicuspids. And,
Be the first spine.
pardon? Second bicuspid next. If you think about it, what we just did when we did surface preparation, we really did cavity preparations on 10 teeth, didn't we? Okay, let's take that 2mm tip for 1 second. And close your eyes. Close your eyes. I gently press on that, but I don't push hard. Close your eyes. Now we'll go to the left cuspid. Now, you may not realize this, but if you take a look at how far I am from the teeth, you'll see I'm about 10-15 inches from the tooth, but visually I'm only 2 inches. That's why you need 4 power. If you ever want to test the difference between 2.5 power and 4 power, you want to get a magazine cover with a 4-color picture on it and look at it with 2.5 power magnification. And you'll see a beautiful picture. Then you'll look at it and with 4 power and you'll see a bunch of pixels. Close your eyes. Close your eyes. Close your eyes. And close your eyes. We are now airborne. Wheels aren't up yet, but we're airborne. And so I'm going to go on the lingual side and remove the excess. Okay. Now we're going to take the 9mm tip and place it on each lumineer for 5 seconds. Close your eyes. 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 So let's take a look now with the large mirror. Put your head down just a little bit, your chin. That's good. Thank you. Okay. And if you get, just look how thick those incisal edges are. But look what they look like from the labial. So now I'm using a Shure 349 instrument. It's an orthodontic instrument. Never use your hygienist scaling instruments. And when I place these, I make sure that these don't fit like a precise fitting porcelain fused to metal crown with the margins that fit that well. But when I get finished, they do, because the margins are composed of Ultrabond to create my stress-resistant, non-micro-leaking restoration. Now let's take off the paint on dental dam on the lingual side. We'll use our Shure 349 again. And all of these instruments that I'm using are in the clinician's finishing kit. And I'm just picking off the paint on dental dam. And when I get that off, then I've got a clean surface. Okay, let's see if we can get that off. Okay. Got most of it off. But look at the lingual side. See how it's almost cleaned up? Remember what a mess that was? Now we're going to do finishing. That's step 3. Look how nice the anatomy looks in there. And all I have to do now is start opening up the embrasures. And the next little instrument I'm going to use is a 12-fluted burr. I never use a burr on tooth structure because that's what causes sensitivity. So I go all the way back here. I've got 4-power magnification, and I start removing the Ultrabond first. And I use the burr because it won't remove the porcelain. If I were to use a diamond, I wouldn't know if I was cutting Ultrabond or porcelain. But when I use a burr, I can let the porcelain be a guide for me, okay? And I'm just going around these margins, separating the Ultrabond from the gingiva and from the porcelain. But I'm not removing any porcelain, and I'm staying away from that labial surface. I don't want to scratch it. And what I'm doing on the lingual side, I'm using an American football. I understand your footballs are round and ours are elliptical.
I had a term for that. It's called a rugby ball.
Rugby ball, okay.
I've been here long enough already.
Yeah.
A man's game, they say.
Oh, that is a man's game. Now you got to remember, why are we doing this? He didn't have any caries. His dentition was sound. And all I'm doing is what? I'm just taking away. Now what we're going to do, I guess we'll check occlusion. Let's check occlusion right now. So now we'll close. Okay. Now you can take a look at those teeth. Remember what he looked like? Here, in an hour, one visit, we make these just grind around a bit. Open. And let's see what the marks tell us. Well, we've got some Ultrabond here. And what we're getting marks on natural dentition, natural dentition, natural dentition. Got to look out for this. See this right here in this incisal? It's not very dark, but this is where you could start getting them to chip off. And we got natural dentition. So we're pretty close to where we want to be. Now I'm going to take a long, narrow diamond, and we'll start defining the interproximal embrasures and the gingival margins. Now I'm removing the shoulders. Remember, if I didn't prepare the tooth structure, and this is that section where on the second bicuspid, the distal part fractured away. but the mesial part is very much intact. And what I'm doing is going through and defining these embrasures. Because you have to remove as much ultrabond as possible before you open the embrasure. Because if you try to open it and it's filled with ultrabond, you have to exert too much pressure and too much force. And I'm just letting the contours of the tooth direct my diamond. And the ultrabond is softer, so it just falls into those embrasure areas. If I used a carbide next to the dentin, he'd find it very sensitive. But if I use an ultrafine diamond with water spray, never work on your porcelain without water spray, or you're going to cause it to micro crack. You can do a lot with ultrafine diamonds that you can't do with carbides. You want to see if we can open these contacts? Here we go. Do you have to open them all on the placement visit? No. Now, if you get in there and you find that you're having trouble sawing through, stop sawing and start rocking, like that. You just go around and it's like taking an examination. You do all the easy questions first. And what we don't get today, we'll have the patient back on another visit. Let's see what happens here on this thick one. Well, this is more than I hoped for. See? And if I don't get all the way through, what'll stop me is what? Ultrabond. So I start rocking. See how we're opening these here? This is a safe-sided diamond. What do we call these? Seri sanders. And we're sanding. First we open it and then we smooth it. Okay? And what I'm going to do right now, if you like, would you like to watch me prepare the lowers so they can get veneers on his next visit? I can do that right now for you, so you watch the whole process. I'm going to use a medium grit diamond. So what I want to do now is I want to remove the enamel and narrow this incisal edge so they're not square. And if I get down to anything sensitive, raise your left hand right away and I'll stop drilling. That's the beauty of not giving the patient anesthetic. This right central is poking up a little bit, so I want to get that more in harmony. So I'll just shave a little of that off. And you want to take as little off as you can on lower teeth, because lower teeth are very small. You want to see me take an impression? Here, we'll do the double bite right now. Lisa's getting one side loaded, and I'm going to, and she's just about got that loaded. And we're going to put a whole bunch in there. I made a mistake here because I should have squeezed some extra out, and I did, back in the mucobuccal fold. Because when you take impressions or use anything that comes out of a static mixer, you want to expel some of the excess first. And let me see what happens here. You got to be really fast. Okay, close.
Set a glove.
And I need to stay closed and don't move.
Set a glove.
You don't want to take this impression out too soon. Because if your Lumineers fit the model and they don't fit the teeth, there's a good chance that it was taken out prematurely. So an extra 30 seconds to a minute on impression taking is a good investment in protecting yourself against the margin of error. There you go. Well, we have our patient in today from, what was it, last week or 2 weeks ago?
2 weeks, yeah.
Yeah, so Richard, why don't you tell us about some of your experiences since you were here last time?
Well, everybody who knows me finds it incredible what you've done to my top teeth.
Uh-huh.
Incredible. No pain, when you did it, and the change it's made to my mouth is incredible.
Are you getting used to the sensation now?
I'm getting used to it. It's still not totally gone.
Yeah.
But I'm getting used to it now.
Yeah. Well, it takes a while because we made those. If you take a look at his smile, get your head back a little bit and get in a little bit closer. Now we're going to take a look at something because you'll see why it takes them a while to get used to it. See how thick they are? And they must be 5 or 6 millimeters thick. But when you look at them from the labial, they look just like natural teeth. And what I did last time, close, is I modified the lower teeth. Let's see, we got a little. Okay. What I want to do, you can see it has a rather deep bite. And I want to see how much space we have between the lowers and the uppers. Because if we don't have space, then something's got to give. So what we're going to do is put these in, and I'll probably reduce the maxillary. Yeah, it's a little difficult to see because he's got such a deep bite, but I'll see what we can get close. Put your head down. There's space there. Oh, okay, that's good. And we'll try it up in here and see if we can get behind here. Close. A little tight in here, so when we put these on, he's going to have prematurities on those centrals, and he's going to be tight on the cuspid. So we'll place it and then remove the opposing dentition rather than remove the enamel from the teeth we're going to place these on. And what we'll do is check 1 or 2 of these lowers, put these on. Which tooth? Lower left central. It's 1, 2. Okay, that works. And the right. And the right lateral. And we're not looking for marginal integrity here. We're just looking to see if this will become a matrix that will fall into place when it's filled with the ultrabond. And I think we got a winner here. All I have to do now is be sure I do the rest of the steps and fill it with ultrabond. And we'll begin doing, what do we have, cuspid to cuspid. All right, now the next thing we're going to do is put a little paint-on dental dam behind, and that's to hopefully keep the embrasures from getting filled with ultrabond. But one of the things we have to guard against is overfilling the embrasure and then not allowing the luminaire to seat. So close your eyes. It's the best way of protecting them. Close your eyes. About a 3-second burst. About an inch from the surface. Close your eyes. All right. Now we'll start etching it with etch and seal. It's medium viscosity. And I like to use a medium viscosity because I can push it around and have control and it doesn't run all over the mouth. Yes, it also contains aluminum oxalate. Brush, please. And put the 10 UAB on. Okay. Since we put these on last time, we know what shade we're going to have to take, so we're going to save a lot of time today not selecting a shade. I like tenure AB, of course, because it's not light dependent. And in combination with the Ultrabond, it works really well. Now we'll put the tenure S on, and we'll just start placing the Lumineers. Need some more tenure S. Tenure S is very good for getting rid of the tri-end paste when we use it. We didn't use it today. But it also protects the treated surface from contamination. Remember, there's a race that begins between resin and contamination. Whoever gets there first wins.
Left central.
Which?
Left central.
Okay. Lisa always calls out the name of the tooth, and it's a good thing she does because I was putting it on the right central, thinking that that's where it would be, but right central. We want to get the what? Right lateral. The right cuspid, and then we're going to go right away to the 2 millimeter spot for 1 second. Close your eyes. Close your eyes. Close your eyes. Okay. Now I didn't spot cure the left central because I might inadvertently cure some of the area in the adjacent contact. Then this wouldn't seat as easy as it does. So this one has not been set yet, and this one has. See this little spot, this little spot? That helps hold those in place so they don't slip around before we do the final bonding. Take a brush here and get rid of a lot of this excess. Okay. Close your eyes. Close your eyes. And close your eyes. And what I'm going to do with this now is wipe most of this off here. Then I'll take the brush for the interproximals, and this really reduces a lot of the finishing time. So you just wipe that out as much as you can. Now we'll take and give it a 5-second burst. Close your eyes. Close your eyes. Close your eyes. Close your eyes. The routine I like to follow is place the light, close the eyes, and push the button. Okay. Now we'll take an Explorer and go around and see if the key areas are polymerized. Give me the brush. Okay. And then we'll give everybody a quick look back here. And right away, look at these lower anteriors, how nice they look. Look at that transformation. I'll give you a quick look at the backside here. So where we've got the blue paint on dental dam, that'll just peel off. Just start taking this off. It's very easy to remove. All right, now we can sort of relax. We have done surface preparation and we have done bonding. So the first thing I'm going to do on the lowers is I'll take the football-shaped diamond and I'll go through the lingual side and blend the porcelain, the ultrabond all together. And because I'm working with 4-power magnification, and I have a focal length of 15 inches, I can see and I'm taking a long, narrow diamond and going through the embrasures. Okay, now we'll take the labial surface and we'll take the 12-fluted burr. Now we're going around the gingival margins and removing the ultrabond. And once again, because I have a 12-fluted burr, I won't remove the porcelain, but I will remove the ultrabond. Okay. And I'm using a shear 349, if you recall, on the maxillary, because we don't want to scratch the glazed porcelain. Now we don't get it all off on this visit. We usually have the patient back a week or so later. And we'll take a long, narrow diamond now. When you have magnification and you have the sapphire light, you have ultrabond and serenade porcelain, these are really fun to do. They're simple, they're easy. Now we'll check the occlusion. Gently put your teeth together, gently. And sort of grind around wherever it feels high, but don't do it hard. Open. Okay. Okay. A little heavy here and a little heavy here. So we're going to relieve the maxillary teeth first with a football-shaped diamond on the lingual side. We have a lot of enamel on the maxillary. And I'll look at some of these margins around here. Blend them. Gently close. Close. And your back teeth and grind around. Open. So now we'll take the long, narrow diamond and we'll take a little off the face of these teeth where they're a little heavy on the lowers. And I'm blending a little on the lingual here just to make sure it gets supported by the tooth. Defining these interproximals is everything and giving it a nice lifelike look. Okay. Gently close. Gently grind your teeth around. Open. Yeah, we're getting better. Now I'm taking the Seri saw, which you're all familiar with, and because these are lower anteriors, I'm only going to open the contacts that are easy today, and then tomorrow I'll have the patient here for finishing. And I'm going to have every contact open today. I didn't expect that. But I'm not going to use a sander until tomorrow, because that's when I want to go and do some more final finishing. Close. Wind around. Open. And this is preliminary. It's not final finishing. Now let's take a look at the entire mouth. Back. Look how we've transformed him in a couple of hours. You haven't had a chance to look yet, have you?
not yet.
Here's Samir. Yeah.
Off to the side.
Yeah.
Head
Wow.
over this way, huh?
Wow.
Huh?
Amazing.
I'm Richard Pickard, and I've always had very bad teeth. Front ones were, I had fangs at the two sides. People used to call me Dracula. And the bottom teeth I had half knocked off when I used to play rugby a lot in England. So I was always afraid to smile and never smiled. The pain, I've been to too many dentists who've hurt me in the past, so I don't like going to dentists. So this is a great way of fixing me without having the pain. My new smile now has made my confidence far greater. I've always been quite a confident person. I have to do public speaking and presentations, but I feel I can actually smile while I'm doing it now, which is important to me. I chose the shade that I did for my Lumineers because I wanted a natural look. Americans tend to go for a Hollywood smile. In the UK, we tend to prefer to look more natural. And the dramatic difference it's already made in me is enough, I think. My friends and family haven't seen my Lumineers yet. I go back to England next weekend, so they'll see it then. Other people in the UK can benefit from Lumineers just as I've done. Most people in the UK of my age or older have suffered from poor dental health. The new generations coming along, healthcare is much better, but the old generations, it's been very poor. People tend to have good teeth, but they're either discoloured or disfigured. And Lumineers would be a superb thing for a vast number of people in the UK.